So my name is Dr. William David Freeman. I'm the Neurologic Critical Care Director at Mayo Clinic, Florida. What constitutes brain injury? I would say a lot of different subtypes of brain injury, but it just means that the neuronal or brain tissue has been injured. Brain injury comes in various forms, so there are brain injuries associated with stroke, like ischemic stroke and hemorrhagic stroke. There's also a traumatic brain injury we call TBI, which is associated with concussion, and also like motor vehicle collisions. An epidural hematoma is the classic example is a person playing baseball. The baseball hits them in the side of the head. There's an artery that runs around the temple, and that one is sheared off and it's torn. When the person's hit in the head, they lose consciousness, but they wake up rapidly and they seem to be normal. However, the salient finding, and they put this in medical school exams, for example, is that the person gains consciousness, then becomes progressively drowsy. And the reason why the person becomes progressively drowsy is that blood starts to expand out like a lens or a mass and compresses on the brain, and the brain, as it gets compressed, gets less blood flow, and the mass effect pushes on the brain stem and people get sleepier. And when that continues to expand, it herniates or it pushes on the brain to such a severe extent that the person dies. The brain is like a sponge, and this collection of blood is fluid, but it becomes harder and harder, and as it expands, it tears other blood vessels, and as it pushes harder and harder on the brain's blood vessels can in turn tear, and it can snowball and escalate. So it can be rapid, and it can also be delayed. It can happen within a few minutes, or it can take several hours. And the symptoms of headache, worsening headache, neurologic symptoms such as numbness, weakness on one side of the body, the face, arm, and leg, for example, as well as double vision, trouble speaking or swallowing. Children may not display the typical things or give a good history to someone. They may not say that they're numb on one side. They may not say that they're weak on one side. Children are difficult because they just may be sleepier and get gradually sleepier and sleepier, or they may lay down and you may not be able to see that they're not moving one side. Another sign is if they have nausea and vomiting that's unexplained. If you have any of those symptoms or had a significant traumatic brain injury, seek medical attention. It leads to better outcomes, earlier intervention, and perhaps you don't have to have surgery. But if you do need surgery, it's done earlier, which leads to better outcomes.